Hey everybody, Katie Harris here from This is a podcast with the Beyond the Medical Algorithm podcast. And today I have Heather O'Neill on with us, and we are going to be talking about all things vagina. So if you're not interested in that topic, I would jump now. But we're going to go deep on this one. Excuse the pun, uh, but
Everybody
anyway.
leans in closer to the speaker now. They're like, vaginas, yes, please say more.
Absolutely. So Heather, tell us a little bit about you and your background.
Yeah, so I'm Heather O'Neill. I am a certified nurse practitioner and a midwife and a lactation consultant. And I own a comprehensive women's health practice called Busy Moms Healthcare in Morgantown, West Virginia. And that is a pretty fun time. I actually started with just lactation and I built it out from there based on patient needs. And the patient needs that kept coming up were sexual dysfunction, incontinence, pelvic floor issues post birth. And they would ask me, you're a midwife, so can't you treat this for me? And I'm there serving them in the space of lactation. And the answer is, of course, yes, I can, but my system isn't really set up for that right now. So over time, it has morphed. I have set up the system to serve the people and give the people what they want. And what they want, large in part, is to live a very normal, healthy, vibrant life, to get back to feeling like themselves as soon as they can post-delivery, and to really change the way they feel about common versus normal when it comes to women's health and pelvic wellness. So I've really dived deep, as you would say, into this space, and I could not be more happy because there is an aesthetic piece to it. Of course, the platforms that we use have some aesthetic pieces that come with it, but I was absolutely shocked at the medical outcomes that I was seeing, the positive medical outcomes from these treatments, which then bleeds into positive lifestyle changes. And, we could talk more and more and more about that. So that's me. That's what I
Okay.
do. I never
It's
stop.
all right. So these women that you're doing the lactation with them, they're complaining of what are some of the things that women would talk about with you that made you believe that vaginal rejuvenation was like a thing that needed to be addressed?
So breastfeeding is a really dry time in the vagina. It's low estrogen time. The tissues have also been through a lot. So we're having dryness, but we're also having, sometimes we tear when we give birth. We have some scar tissue that's formed. And then, you go to your 6-week OB visit and they give you the stamp of approval to have sex again. And everybody just kind of crosses their fingers and holds their breath and hopes for the best when they have sex for the first time. And that gives me feelings. I want to make sure everybody feels good about that, first of all. But so scar tissue, dryness, incontinence, like I'm not making it to the bathroom, especially like I just sat down to breastfeed and I have to get up to pee. Or I'm not making it to the bathroom all of the way. And it's hard to take care of myself and my pelvic floor and the baby. So that's my patient population, which is postpartum. Other folks in my comprehensive women's health clinic are seeing more primary care and women's health. So we're offering hormone replacement therapy, and that population often had those issues postpartum that were never addressed. And now we are in a low estrogen phase because of aging, because of perimenopause. And so we're seeing that resurgence of the dry vagina, the scar tissue that was never treated. Now we're having vaginal tissue atrophy, like the tissue is actually starting to shrink, not being able to tolerate quite the pounding that it used to take, if that's the kind of sex that you want to have. Are we allowed to say that on this podcast?
Absolutely.
Okay. Okay. So it's the same concerns. It's just different populations, and the estrogen is low for different reasons.
So how prevalent is this problem? Let's take postpartum women. Like, I mean, is this in everybody? Is it just a subgroup of people? Like, what is your sense of it?
I would say probably at least 75% of
Oh,
my
wow.
postpartum patients are having at least one of those issues,
Okay.
if not more than one of those issues. And they are told repeatedly that time will heal all wounds, that once their core gets better and once they quote unquote get back to themselves, it will heal. And some of that is true because the human body is amazing, but how long that will take is the big question mark. Like, how much longer do I have to wait to feel like me again?
Hmm.
Um, and, in that time, what is falling apart? Is your marriage falling apart? Is your exercise routine falling apart because you can't stop peeing your pants? Um, are you no longer taking your kids to the park because you're worried about being able to find a bathroom? And now we're treating depression instead of treating the root cause. That's sort of what I see. So in the words of one of my other favorite providers, who's a chiropractor, that I interviewed on my podcast, he said, "You grow into the problem, not out of the problem."
Yeah. Okay, so your guess is about 75% of women are going to have one of the issues that you talked about, and time will probably heal some of those issues. But what happens if time doesn't heal those issues, and or they just don't do anything about them? What kind of path are they on?
So we will see a lot of the body trying to compensate. So we will have some muscles, for example, that our brain can access in the pelvic bowl, and they'll just over tighten those. So this is where we get the mom butt, where we're tucked in all the time. We've like tucked our butt cheeks up and under just to hold everything in. This is where I always tell people, like, it is not your fault that we were designed to be vertical beings with a hole at the bottom, and we're supposed to keep everything in, you know? So when we give birth, specifically in this population, I'm talking about postpartum, the pudendal nerve is really long. And sometimes it stretches really, really far when we're actually pushing a baby out, and the nerves sort of fray a little bit. And then that pathway of communication between the brain and that pelvic bowl is just a little bit not dialed in. So some muscles we can access and some atrophy because the other muscles are working so hard. So we have some tightness and some laxity at the same time. That's when people will complain of like more painful sex in different positions. Like this one position I used to love, now like almost towards the back of my hip, it's like, oh. They get sent to a pelvic floor PT, who I love them, by the way, love them. They'll do a digital exam and they'll identify that tight muscle and actually have to do a release, like a manual release of that. With the platforms that we use, the Empower RF, we would use the FormaV handpiece to sort of loosen that up. It's almost like a hot stone massage inside. So trying to help bring blood flow to that area, wake up those soft tissues, and relax some of those muscles that have been working way too hard. So we'll see that. So we'll see some over tightening. With the dry vagina, we'll see a lot of that tends to be more of like confrontation with the medical system, depending on who you come in contact with, whether or not they are pro-vaginal estrogen cream or anti-vaginal estrogen cream, how much they know about breastfeeding and how much they don't know about breastfeeding. The short answer is yes, you can use vaginal estrogen cream and it's okay with breastfeeding. So we see a lot more with that dry vagina stuff. We see a lot of confusion. We see a lot of depression. We see a lot of use of lubes that maybe are irritating to the vagina, because you sort of need to know more about lube than you ever thought, like
Right.
oil-based, water-based.
Right.
So I see a lot of that too.
Okay. Yeah, that is a lot. So with the what is your take on the estrogen cream? So like I know there's multiple different types of estrogen. Like, does it matter, or and how does that work?
Well, everybody is a different level of an absorber of
Mm.
estrogen. So, you're not really, it's sort of like throwing spaghetti at the wall a little bit, but like definitely throw the spaghetti. Like we know that you're in a low estrogen time. We know that if you have a dry vagina, barring any like infection or anything crazy, that, those tissues are screaming for help. So, I'm kind of down with any vaginal estrogen cream, to be honest. Doing it every night for 2 weeks, followed by twice a week after that, until you're feeling like yourself again. Those
Yeah.
tissues have kind of bounced back, and then you can maybe taper a little bit.
Okay. So now, kind of transitioning over to your postmenopausal woman, how are her issues different or maybe the same as a postpartum woman?
Okay. So this is where I try to explain to people without scaring them that it's not going to get better on its
Oh.
own, you know? So like if I'm talking to a 22-year-old that just had a baby and is experiencing incontinence, is there a chance that her core is going to snap back, that her pudendal nerve is going to heal, that her brain's going to get back on board with all of the muscles in the pelvic bowl and pull it all back together? Yes, there is a chance of that. I don't know when. If I'm looking at a 50-year-old woman who is like, yeah, I haven't bled in 6 months, my vagina's dry, I have some incontinence, that's not going to get better on its own. So as we get older, we're just going to lose muscle tone. We're going to lose collagen. It is known. This is not our fault. This is just the way of the world. And the estrogen hormone is our vitality. That's what we need. And collagen is the thing that holds it all up and holds it all together. So that's the difference for me when I'm explaining to people, like, this isn't something you're going to wait out. Perfect example, client I had today is actually a personal trainer going through perimenopause, works out every single day, goes to pelvic floor PT, does the exercises, is still experiencing bladder leakage, especially with some of the exercises she really likes to do, like jumping jacks, longer distance running, more than half a mile. It just can't hold anymore.
Mm-hmm.
And so it's not going to get better for her because she's already doing all the things. So that's where we have to step in and say, what can we do to help support this person that's already working her ass off to make sure that she's preserving her body in the best way possible?
Yeah. So yeah, I remember that, like taking my son to the trampoline park, and I'm like, "Oh, this looks fun," and it's like one jump, and I'm like, "Oh no, 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 no!"
And then your kid's like, where are you going?
Yeah,
And then
mommy,
do you
jump
bring
with
them
me.
with you? Ugh,
Yeah.
mess.
I'm like, I need some pads. Um, so, yeah, all right. Well, let's talk a little bit about solution options. So, what exists out there? What can women actually do? What are the options that they're offered, and what are some of the things that maybe they're not offered? And pelvic floor PT is definitely something, and I feel like that's pretty well known. Like, people know that for the most part anyway, that's an option.
It is now. I would say in the past 10 years, they've really had more of a um, PR campaign, if you will, towards pelvic floor PT. I think where they really shine is with the trauma that comes with the pelvic floor unwellness, if you will. Like, women hold all their trauma in their pelvis. It's
Hmm.
it's just the way it is. And so when you've been through a trauma, being able to sit with a person who understands every single muscle, who is providing trauma-informed care and can help literally point to the thing that is broken and show you, that is hugely beneficial. That's what I got out of pelvic floor PT. I got the exercises as well, and that was helpful, but I needed a little bit more. The other thing that people will typically get, other than a pelvic floor PT referral, is you should lose weight, you
Mm,
know?
thanks.
Uh, yeah, thanks. Yeah. So you should lose weight. If you lose weight, then you probably won't have to pee your pants as much. Okay, well, like, how long is that going to take? And is that a guarantee? Okay. And then they say you should exercise and you should work on core. And then sometimes they will even talk about bladder training. So we'll be offered some bladder training occasionally, which is like, keep track of a bladder diary, and maybe it's stuff that you're eating. Maybe you should cut out wine. Maybe you should cut out coffee. Maybe you should stop drinking water after 7 p.m.
Yeah.
So
Maybe just
like,
don't get out of bed. Just
yeah,
stay in
just
bed.
what if you just didn't get out of bed? So those are the traditional options, I would say. The vaginal estrogen cream, is there and has been there for quite some time. There's the rings, the estrogen rings, which is fine. It's all basically the same kind of concept. There's also a pessary. So they've got the pessary option where it's sort of like a hard yet flexible silicone ring that you push up into your vagina, and it sort of expands and ideally holds everything up. Not sexy, not a sexy thing. Also not a guarantee. Has to be fitted, has to be cleaned, has to be changed out. And then of course there's surgery. So everybody has heard about the mesh surgery, the bladder slings, and everybody's also heard about the lawsuits with the bladder slings and, the scar tissue. And sometimes you hear from people that it's life-changing, and sometimes you hear from people that they have the same exact problems that they had before, except now they have scar tissue. So that's kind of where we are typically, until I learned about the InMode Empower RF platform and all that they were doing for vaginal rejuvenation and pelvic wellness. And I don't know if you want me to talk about that, or if you wanted to talk about your experience with it.
Yeah, no, I definitely want to hear your experience with it. And it is something that, we invested into the RF platform as well, because there were so few options. And, I had seen my sister go through it, and she ended up getting the mesh surgery and the sling and all that kind of stuff. And, the one statistic that I had heard was that adult women, bought more diapers for themselves than they did for kids.
Yeah.
And it's like your options are, stay in bed and wear a diaper or have surgery. And it just was crazy to me that that was the only two reasonable options that were out there. But, I will say with the RF platform, it is a sensitive topic. And you being a midwife, you're in that position really to kind of talk about these things. And that's one of the reasons I wanted to do this podcast, was just to kind of normalize this conversation and talk about, and like you said in the beginning, there's common versus normal. And so this is a common topic that's not normal. Like this, there's something that we can do about it. So yes, I'm very interested in your experience with the platform and how it's changed kind of the conventional offerings that have been historically offered.
Well, a lot of people that come to me have already tried some of the things. They've already, quote unquote, failed out of pelvic floor PT. And I hate that word. I really do, because women already beat ourselves up all the time. I am one of those people that failed out of pelvic floor PT because my lifestyle is such that I could not keep up with the exercises. So then every time I did have an incontinent episode, I would hate myself a little bit more. Like it's something I'm not doing for me. It's one more thing that I can't do. And so the Empower RF platform offers 3 hand pieces that work in different ways. To support different parts of the pelvic floor and to solve different problems. And for me, one of the things I like best about it, other than the fact that it is minimally to no invasive, it's got long-lasting results. It builds a good foundation, not just for your muscle, but for your soft tissue and for your mucous membrane. And it's something that I can do for them. Like, you're doing for everybody else. You come in, you lay in my beautiful room on my comfortable table, and let me do it. We've got a speaker, you can hook up to Bluetooth, you can zen out, we don't have to talk, we can talk, whatever you want. I will take the burden, let me do it. So with that being said, they love that, because they're like, wait, how long is this going to take? Can it take longer than 30 minutes?
Can I just lay here for an hour?
Yeah. Like, can we do it with the lights off? Some of them we can do with the lights off. So the first hand piece that we use is the VTone. The VTone uses electrical muscle stimulation to work with the muscles of the pelvic floor to really get them awakened. What I've found with my clients is that the more incontinent they are, the less estrogen they have, the higher the energy we have to use. You can really tell how asleep those muscles are based on the energy that you have to start with. I had one client who's in her 70s who wears a diaper all day, every day. And we almost had to go all the way up to the max energy because her muscles were so asleep. They were non-responsive to the electrical stimulation. We finally got her muscles reacting. And as her treatments have progressed, we've been able to come down on the energy, and she's getting the same therapeutic treatment, but doesn't need as much effort.
Mm-hmm.
In addition, I have been having people, not for the whole time, because I do want it to be a relaxing 30 minutes. So a 30-minute treatment is usually what we're doing. For just a couple minutes out of that, sporadically, I will have them try to work with the machine. So as it contracts the pelvic floor, really use your brain to try to squeeze the muscles and pull the device up deeper, just to really help the brain get back on the same page. A little bit of biofeedback there. So the VTone with the muscle has been excellent. And has that been your experience too?
Yeah, no, absolutely. And that, I like the VTone. And what the VTone is interesting because it's like, in physical therapy, they'll tell you, or, just in general, to do a Kegel, and you think you're doing Kegels, and then you do the VTone and you're like, oh, that was not a Kegel. That's a Kegel.
That's a Kegel. Yeah. And
Yeah.
it doesn't hurt, but it is
Right.
weird. It
Right.
feels weird. So whenever we turn the machine on and I start at the very lowest level, I say, let me know when you feel anything. And when they do, I say, all right, now tell your brain it's not pain, because it's a different feeling than you've ever felt before in your life. And your brain is going to instantly be like, is it pain? It's
Yes.
not. It's like a weird buzzing sensation, but
Right.
in your vagina, it's like, it's fine, but there is a level at which you're like, I think I'm good here at this level.
Right. And I would say it's not stimulating in a way that you become aroused.
Oh,
It's
no.
yeah, it's not that type of buzzing.
No, but yeah, not that type of buzzing, more like electrical buzzing. But I will say, after my first V-tone treatment, it did bring so much blood flow to my pelvic floor that had not been there previously, that later on that night, I was folding clothes and I was like, am I horny? But am I? Like, I might actually be. This is kind of exciting. Like, whoa, hello. So that is not a side effect that we were trained on that might happen with the V-tone, but it makes sense because it's all blood flow.
Right.
So anyway, that's the V-tone. That has been hugely successful. I would say 100% of my patients have seen improvement in their incontinence with that.
Just with VTone, that they have results with incontinence.
Yes, absolutely.
Wow.
But, for the most part, people are at least doing the FormaV and the VTone
Okay.
package together because of those overworked muscles that are so tight. And because most of us do need a little bit of that collagen reboosting, that cellular matrix, when you've had a baby, or even if you're, low estrogen perimenopausal, we just need more collagen there. We need some healing, and we need more blood flow, and we need that cellular matrix to be a little bit stronger so we can get better faster. Like if we were athletes, I like to think about it this way. If we were athletes in the NFL and we even had like a splinter like on our arm, they would be like, oh my God, we have to immediately treat this because you are worth so much. Your value is so incredible that we have to make sure that we fix this. Yet a woman will have an entire ass baby and push it out of their vagina, and they're like, yeah, you're gonna be dry. Like those muscles are gonna be sore and those tissues are gonna feel like not the same. And you're like, okay, where's my value?
Right.
So that's where the FormaV and the VTone married together are amazing.
Mm-hmm.
And the FormaV is like ironing out the inside of the vagina. So we're using bulk heating to bring the tissue to a certain temperature, which is typically around 42 degrees Celsius. And we keep it there for about 2 minutes. And when we do that, we are creating changes at the cellular level to build more collagen. We're asking the body, using a little bit of a bulk heating injury, sort of, with additional blood flow for healing at the same time, to fix itself, which is beautiful because the side effects are nothing other than greatness. Whereas medication always has a freaking side effect.
Mm-hmm.
So this one I like as well because it's very slim and the tip is very small, with the bulk heating elements on the end. So if we have somebody that actually has vaginismus, which is like very, very over tightened vagina from trauma or sexual trauma in their past, I will actually have patients insert that one themselves and then I will twirl it. But like they can put it in, which is really nice because sometimes that's very triggering for people. So that's why I like the FormaV and I like the VTone. And then the third handpiece, which is the big sister of the group, is the Morpheus 8V.
Yeah, this one's always very intimidating to talk about.
It is. It is. I love talking about it though, because when we think about the Morpheus 8V, which what it is radiofrequency microneedling, people have been doing this on their faces and on their bodies for years and years and years. And by people, I mean like Nicole Kidman, like that's why she looks so young. It's because she got Morpheus treatments and she gets them probably every year to just maintain that collagen, prevent the separation of the fat pads in the face. This is technology, like we're willing to put it on a face that's valuable, a face that makes millions of dollars every year with their face. It's safe. There's almost no downtime, which is incredible. And then some genius out there was like, what if we did this in the vagina? What if we made a handpiece that actually fit in the vagina and we did this in there? What would it do to those tissues? And the results are amazing because you can really target where you want it to go. So much like when you're doing Morpheus on the face and you can contour a little bit, everybody's a little bit different. They have a different, like maybe they have a fat pad here under their chin. Maybe they want a little bit more contouring under their cheekbone. With the vagina, you can do the same thing. Maybe they had some scar tissue from birth right in that perineal area. So maybe we can work that more specifically. Maybe because because of the excess vaginal tissue from weight gain and weight loss and weight gain and weight loss, their clitoral hood is really large now and they're not able to easily access their clitoris like they used to be able to. Well, you can use the Morpheus with their customizable settings to actually do some skin tightening, tighten that tissue up so someone can find their clitoris. It's like amazing. You can take that thing and punch it directly on the urethral sphincter and ask that sphincter to build collagen around it so it can once again squeeze at the correct time when you're at the trampoline park. you know? So in addition to that, it's working on the mucous membrane. So it's going to be the linchpin in really making sure that vaginal tissue, you're turning back the hands of time, you're creating healthy cells, you're kind of burning out some of the unhealthy cells, and you're regenerating cells that make moisture, the goblet cells that secrete all of the wonderful secretions that make vaginas so freaking magical. So I love the Morpheus. I do offer people, I will tell you in my clinic, if they are intimidated by the Morpheus in the package with the vagina, I'll say, do it on your face. We'll do the VTone and we'll do the FormaV. We'll do the Morpheus on your face. You will call me in 3 months and you will want it in your vagina, I promise. And almost all of them do. Oh no, where'd you go? Katie? Or like, oh, I don't care what it looks like. I don't need the skin tightening. When the labia majora sort of has that drooping at the bottom just from being pregnant and not pregnant and weight gain and not weight gain. But almost every single time, I'm like, while I'm down here, you want me to just hit this a couple times? And they're like, I mean, yeah. So, I mean, that's kind of nice too. So it's like health and wellness. But, I've had people that have started having sex with their partners again because they could. I've seen patients that have gone through radiation on their vagina because they've had vaginal cancer, like vulvar cancer, where part of their vulva was removed. And their tissue was basically like rope. It was so hard. The FormaV plus the Morpheus allowed them to be comfortable enough to have sex with their husband again. That's life-changing. I mean,
That's
truly.
really rewarding to give that to somebody.
Yes. So is it aesthetic? Yes. Is it medical? Also, yes.
Yeah. I love that. Yeah. So, because I mean, some people, like you said, you know, they, some of the people, some of the women, when you first start discussing it, I think they think maybe it's almost a luxurious thing to do for themselves. But like, this is real power for women to recapture this and to, you know, have a functioning vagina that doesn't leak, that doesn't, you know, have all these issues. And it's so much more than aesthetic, and it's so much more than just a luxurious thing that, you know, rich people do for themselves. Like, this is really necessary for women to take control of this. And I love that you offer this, and you know, that's why we offer it as well at Philly Wellness Center.
Well, let me say this too. Like, is it luxurious to prevent chronic infection in your body?
Yeah.
You know, like
Right.
when you are perimenopausal, postmenopausal, and your tissue is dry, it is much more prone to infection,
Yeah.
much more prone to BV, much more prone to lichen sclerosis. And keeping that tissue healthy is going to prevent that from happening. And in some cases, they have studies now showing resolution of those issues.
Right.
So, I mean, you can be, I don't care how much money you make and what you do for a living, but if your vagina smells like fish every 2 months or you have itching constantly, you are not your best self. You're not.
Yes.
You're not asking for the promotion. You're not booking the vacation. You're not doing the things that make life worth living. And what is the cost of that?
Yeah.
So that's my thinking on it.
Absolutely. Heather, this is amazing. I love this conversation. I love all the things that you've been talking about, and I'm so appreciative of having to met you and, you know, learning about all the stuff that you do. So, um, if people want to learn more about what you're doing, if they want to come out to West Virginia, like, where do they find you? How do they get in touch with you?
You can find me at busymomshealthcare.com, or we're on Instagram at busymoms.healthcare. And our Instagram is pretty funny. Our staff has a really good time. Let's just say that. If you are currently a breastfeeding parent, you can hop over to my podcast, which has been going on for 5 years, called the Milk Minute Podcast. And at this point, we probably have any topic you could ever think of with breastfeeding. It is no holds barred, there is no filter, and we are not anti formula. We are not religious. We are just medical professionals talking about breastfeeding.
I love it.
So, yeah. Yeah. So that's the vibe, and you can find us there. And I really appreciate you having me on the podcast, Katie, and I'm so lucky that we sat next to each other at breakfast at the conference.
I know, me too. I'm so excited. All right, Heather. Well, thank you so much.
All right, thank you. You guys have a great day.